15, 20 years ago, I started going to another orthopedic surgeon because my knees were bothering me. He gave me the whatever kind of shots that'll take away the pain. And when I started, it would last like 18 months. And the last ones I had lasted me for 3 weeks. He did x-rays and everything. He said it was bone on bone. I could feel it. I could just tell that there was nothing in between the bones that were rubbing together.
Before knee replacements, most patients try anti-inflammatory medications, lifestyle and diet activity modification, quadriceps strengthening. The next line is injections. Once they've exhausted that, then we have to talk about joint replacement. If you waited long enough to the point where you can't get your knee fully extended, you're getting a contracture, or it's getting bow-legged or knock-kneed, it's more beneficial to get the knee done sooner rather than later. And she was starting to get that.
My right knee was done in the traditional way. My left knee was done with the Mako. The first one was 6 weeks. I used a walker. I really wasn't very mobile. The second one that I had, the Mako one, in less than 6 weeks, I was walking without a cane, without a walker, without anything. And I could go up and down the steps.
We're using this Mako machine, this robot machine, and sophisticated CAT scan data to balance the ligaments and put the joint replacement, the parts in more accurately now, and more in line with the patient's natural ligament balance. So they feel more natural, they recover a little faster from that.
I don't really have any problem with my knees at all. I go down hills, I go up hills.
She just, embraces the surgery and the necessary physical therapy to recover from it and then get her life back.
The best advice I can possibly give anybody is don't keep putting it off. It's come far enough. And if you have a good doctor like Dr. Ciotola, there's no reason not to do it.